I want to spend a little bit of time talking about Invisalign first. Really, it's talking about a combination of Invisalign and dental monitoring in the under 10 age group. And it's actually something I get a bit emotional about, because I want to scream from the mountaintop, please stop putting braces on teenagers. We don't need to do that anymore. If we can adopt this Invisalign first approach, effectively we can manage almost every developing orthodontic problem really easily, almost seamlessly, and resolve the need for braces in the teenage years. Invisalign, it's basically clear plastic aligners that move teeth about 1/4 millimetre at a time that you change weekly. So with our aligners, we have the ability in an 8 to 10-year-old child to do things like expand the dental arches, correct overbites, make additional space where there's crowding. And effectively we set up an ideal orthodontic result, albeit in the developing mouth where there are still a number of baby teeth present. That takes us about 12 months. The advantage of that approach is almost the entire difficulty of the orthodontic correction is resolved over that 12-month period. The other advantage is, for most parents, we understand that compliance is a big thing with teenagers. They tend to do the opposite sometimes even of what you want them to do, and we certainly feel that as orthodontists. 8 to 10-year-old kids tend to do what authority says, whether it's the orthodontist, whether it's mum or dad. When we have to come back in the 12 to 14-year-old age group, when they need that final tidy up, they don't need braces, they just need aligners, maybe for 6 to 12 months. Compliance becomes less of an issue because all the hard work, the heavy lifting's been done. So that's Invisalign first, and what we combine with Invisalign first is dental monitoring. And dental monitoring allows us to get higher quality patient outcomes because we're effectively tracking our patients' treatment progress through smartphone videos that you take at home, and which are analysed by artificial intelligence. So what I say to my patients is really what I'm doing is I'm checking your child every week using artificial intelligence, which basically allows me to look at a pixel level of what's going on in your treatment, in your child's treatment. So your child is changing their aligners when the biology tells them to change. We're checking at a level the human eye can't even see every week. And after 12 months, we've resolved most of the orthodontic problems that child's ever going to have. And it's so flipping convenient because you don't have to come back the old-fashioned way to see the orthodontist regularly. Most of what we need to see, we see through the smartphone, see through the dental monitoring application. So the number of appointments over that entire year may be 3 or 4 in total. So it's the combination of Invisalign, a particular product called Invisalign First for the developing teeth, and dental monitoring, which has totally changed the face of orthodontics. And my biggest problem, the reason I want to scream it from the mountaintop is I am sick to death of teenagers waiting until they're 12 to 13 to 14 to get braces put on their teeth. I want to scream from the mountaintop, get your kids in nice and young. Let's sort all this out really easily with Invisalign and dental monitoring, and let's make the whole orthodontic experience so much better for the child, for the parent, and for the overall health of the dentition.